Welcome everyone. Today's SimplePharm video is going to be on norepinephrine. Norepinephrine is a common medication. It's a high alert medication, which means there's significant risk of causing patient harm when used in air. Norepinephrine is frequently used in the acute care or hospital setting, and it's used in some of the sickest patients. Norepinephrine is commonly known as Levophed, noradrenaline, or norepi. Norepinephrine is a vasopressor. It's a potent adrenergic agonist. You may hear it referred to as a sympathomimetic, meaning that it mimics the sympathetic catecholamines. Norepinephrine primarily agonizes alpha 1 and beta 1, with little to no effect on alpha 2 or beta 2. The alpha adrenergic effects of this binding causes an increase in heart rate and strength of each contraction, which increases cardiac output. It also causes marked vasoconstriction in the arteries and venules. Ultimately, this helps increase your patient's blood pressure and helps perfuse the tissues with oxygen-rich blood. So when to use norepinephrine? Norepinephrine is used when there's an acute need to increase blood pressure and perfuse the organs, like shock. Norepinephrine is the vasopressor of choice in septic, cardiogenic, and hypovolemic shock. It's used when all other modalities like fluid resuscitation have failed. It's important to note that administering norepinephrine without fluid resuscitation can actually cause further damage, specifically in patients with hypovolemic shock. Some clinical signs of shock can be the systolic blood pressure being under 90, mean arterial pressure under 65, or if you have a big drop in systolic, anything greater than 40 millimeters of mercury, this can indicate shock. But shock can be present with a myriad of clinical symptoms. While blood pressure is a common sign, it's not the only sign. Others include a rapid heart rate, rapid breathing, skin changes, or an elevated lactate in the blood. For administration, remember that norepinephrine is a high alert medication. Norepinephrine is available in pre-made solutions in dextrose at various concentrations. If you get the medication in a vial, you'll need to mix it with dextrose. It's important to do this to maintain potency. If mixed with NS and only NS, the product can degrade and lose its potency. Ideally, norepinephrine should be given through a central IV line for continuous infusion. It's important to avoid leg veins or peripheral veins just to avoid some of the safety concerns. Drip rates will be done in micrograms per minute or micrograms per kilogram per minute. The dosage will be determined based on the patient condition and the indication and is commonly titrated to the effect that you want to see. When monitoring your patients who are on norepinephrine, you'll be looking at their vital signs. You'll be checking for the efficacy of the medication. This will include looking at the heart rate and the blood pressure. Initially, you'll measure more frequently, every 2 to 3 minutes. Then, once stable, every 5 to 15 minutes. Also be sure to monitor urine output, as this can be an indication of how well the organs are being perfused with fresh blood. If the norepinephrine, for whatever reason, is being administered peripherally, you have to watch out for extravasation. Norepinephrine can cause significant tissue damage and necrosis if this occurs. You'll also want to monitor for side effects. These include headache, anxiety, potentially life-threatening arrhythmia, and other cardiovascular changes like bradycardia. Now let's review of what we've gone over today. Norepinephrine is a potent vasopressor that's frequently used in the hospital. Other names are Levophed, noradrenaline, or norepi. It binds to the alpha 1 and beta 1 adrenergic receptors. It's dosed in micrograms per kilogram per minute or micrograms per minute. You want to closely monitor heart rate, blood pressure, and urine output more frequently soon after you dose it, and then once the patient stabilizes, less frequently. Always titrate to the desired effect, going up or down in the dosage. This is a high alert medication, meaning there's high risk if there's medication errors involved. It's a vasopressor of choice in septic shock, cardiogenic shock, and hypovolemic shock. And some other side effects you can look out for are anxiety, headache, and arrhythmia. Now let's do some review questions. What is the primary indication for using norepinephrine in a hospital setting? The answer is B, to treat low blood pressure. What is the typical route of administration for norepinephrine in a critical care setting? The answer is C, intravenous. When administering norepinephrine, which vital sign needs to be closely monitored? The answer is B, blood pressure. Which of the following is a common side effect of norepinephrine? The answer is C, hypertension. Norepinephrine primarily acts on which type of receptor in the body? The answer is C, adrenergic receptors. In the context of norepinephrine usage, what does titration refer to? The answer is B, adjusting the dosage to achieve the desired effect. Which team member is typically responsible for adjusting the rate of a norepinephrine infusion in a hospital? The answer is B, a nurse. Thank you for watching this video on norepinephrine. Please remember to like, comment, or subscribe for more pharmacology content.